here at Family House in San Diego, and I'm so honored to be part of this family. I'm starting off with a brief story to highlight how we are truly integrated. You heard the same theme echoed through both Myra and Katie's speeches. I'm going to do the same. And how we go above and beyond and really hear the needs of the clientele that we serve every single day. In the fall of 2017, out of our 44 sites or 23 clinics, a patient walked into one of our many front doors seeking medical care for wounds on his amputated leg. He was suffering from wear and tear abrasions, as well as blistering caused by his prosthetic leg. As many of you know, prosthetic limbs are custom fitted, but in this case, the patient was wearing a prosthetic leg that he had found in a dumpster. The injury to his amputated leg made the hard labor that he did on a daily basis absolutely impossible. He was homeless. He could not do painting, gardening, handyman work. He was held back because he did not have benefits, resources, that guidance to get through the steps required to get him the one thing that he needed most to assist him to get back to work, to be a productive member of society. The primary care, the nurses, the medical staff that he engaged with, reviewed his injuries, heard his story. And after treating his medical-related needs, they guided him within that same complex, that same clinic, down the hall, to one of the doors of one of the homeless case managers. He started to attend support groups, develop a support network, and people really heard his story. The team could see the complexity of his case, what he truly needed to be stable long-term and self-sufficient. We used healthcare for the homeless funding to provide gap coverage for his healthcare while he worked with our benefits specialists. And he continued to work with the homeless case managers on developing a personal plan of action to address all of his needs. We worked within our community of providers and teamed up with Alpha Project. Kyla Winters, the woman that runs their hospice program, is an amazing individual. She herself went through amputations, and she speaks openly about it. And she's a strong connection within the prosthetic community, as well as the doctors that make the prosthetics. We were able to connect the dots, have conversations, advocacy, collaboration, and empowering him to use his story to inspire something absolutely amazing to happen. We worked with Kyla and the prosthetic doctor not only to coordinate medical, transportation, but due to the partnership with Kyla and Alpha Project, we were able to get the prosthetic doctor to create the leg pro bono. Healthcare for the homeless case managers, peer support specialists, made sure he continued working with his benefits specialist, his primary care, his specialty care for the required pre-visits to construct the prosthetic leg. So on one absolutely beautiful day, this past year, he was fitted and walked out the door using both of his legs, continuing to do what he did best, take care of himself, be reliant, self-sufficient, and in turn, allows him in his own way to support the ecosystem of San Diego. This is not just an individual's homeless story. This is a human story, a health story, a benefits story, an integration and collaboration story. This is what we do at Family Health Centers. We don't just hear your story. We don't just see opportunity for one piece of the puzzle to be completed. Because in this case, if one piece of the puzzle is completed, for example, this individual's wound care for his amputated leg, nothing would have changed. He would have remained in a cycle of care for that same exact issue over and over again. It took a collaborative team addressing multiple issues in an integrated way, a supportive, loving way, to solve part of this individual's challenges and empower him as a thriving individual. Healthcare for the homeless can provide not just gap medical visit coverage, supportive staff, glasses, dental, restorative dental for those who have lost many of their teeth. In 2018, Family Health Centers San Diego, as Anthony mentioned, touched over 26,000 homeless individuals, spanning from East County to Central, South Bay to Beaches, Claremont areas. Amazing work is being done within the walls of the clinics, at the community sites, but also on the streets where thousands of our homeless neighbors sleep every single night. All of our programs are supported by our amazing street outreach team, which I often see more as mobile case managers. They not only help with coordination of care, transportation, and being the trust builders, bridging clients to services, but they also directly, permanently house people from the streets. The Homeless Services team is contracted to manage the referral flow into shelter beds at Interfaith Shelter Network's annual rotational beds in East County and Claremont regions. We work with these shelter residents on helping them establish medical homes, employment, housing, transportation needs, and work on their individual service plans to ensure a full spectrum of their needs are getting met. We also work within the city bridge shelters, 5 to 6 days per week, offering a comprehensive menu of on-site services. At the Alpha Shelter, we serve 324 shelter residents, and at VVSD, Veterans Village of San Diego Shelter, we serve 200 veteran residents, offering everything from medical via our mobile medical units, mental health services, substance use services, HIV, hepatitis testing, and even joint hepatitis vaccination blitzes in conjunction with the county. Our homeless case managers alone had over 2,000 case management sessions in 2018 alone. 2,000 between VVSD and Alpha's 10. Right next door to the Alpha operated bridge shelter, literally right up this street, we serve the homeless children and families of Monarch School with our dedicated registered nurse, homeless services case manager on site 5 days a week. We even extended our mobile medical unit to offer sports physicals to the children at the start of the school year. And we are working on adding the mobile mental health unit there weekly for parents and children. We talk about the term prevention all the time in conversations. At Monarch, our Family Health Centers team seamlessly is embedded within the Monarch team, lifting up and caring for those children and their families, stopping generational poverty in its tracks. Next, we have our Safe Parking program that will be launching this spring at 3 of our clinic parking lots. Similar to what we offer at the shelter, a full menu of accessible services will be provided to ensure stability and improved quality of care in tandem with exploring housing options. Last but not least, our operations of the City Housing Navigation Center. Currently, we are doing street outreach while we make some necessary changes to the building to accommodate an amazing menu of services. We see this project as an opportunity to expand past that one front door and strategically use all of our regional presence and collaborative partnerships as front doors to ensure there absolutely is no wrong door. We project over 20 on-site partnerships with collaborative agencies. The schedules will shift as we see the real-time data of what the true disparities are in the current populations as we know the shifts. The theme, which you heard by both of these ladies, across all our programs, is focused on using data to drive how we engage, how we support the true needs of the homeless neighbors. We also have the ability to use a multitude of evidence-based practices with everything we do, such as trauma-informed care, critical time intervention, motivational interviewing. There's so much more to come from Family Health Centers and so many more neighbors to serve in our community. In closing, there is no limit when our next steps are informed, data-driven, and built upon the mindset. It will take collaboration, a community, and not just one agency. Here at Family Health Centers, we have some of the teams on the streets, within community organizations, shelters, schools, clinics, and we work together with numerous agencies. The future is bright, and so much more work to be done. Every day, the Homeless Services team helps individuals with complex needs, and they wrap around that person to ensure ultimate success. With that said, I want to have my team stand up. This is only some of them, because some people are missing, but I want to say you're looking at some of the most dedicated, beautiful humans that are here to help, to serve, to truly listen, and tease out those needs and disparity. Cheers to you guys, because this is all about you, the work that you do every single day with Family Health Centers. Thank you so much.